Hi, my name is Dr. Dean Smith, and I'd like to share with you a natural approach to pain relief. Pain is a huge problem these days. Many people have it. Many people are confused by why they have pain, and they're looking for a natural solution. Many people don't want to take drugs or have surgery, and that's why I created this presentation. Fortunately, there are many things that we can do about pain. May not be able to completely take it away in all cases, but certainly can make a difference. And so video is for everyone who has pain, who wants to try some natural methods to try to relieve that pain. Looking on this slide, we can see just one of the factors that might influence people's pain, and that is foods. Certain foods tend to promote pain and promote inflammation. Looking on the left-hand side, we can see some yummy looking foods like French fries and hamburgers. But these types of foods tend to promote pain and inflammation. Looking on the foods to the right-hand side, we can see plant-based foods. And these plant-based foods tend to promote less inflammation and ultimately less pain. So I'd like you to just realize that there's lots of hope out there, and I'm going to try to share with you what some of the factors are that can improve your pain naturally, realizing that there are a lot of different factors that can help, and I'm going to share with you a subset of what I've found to be effective, but there are many, many more things, and perhaps in future videos I'll go into in depth, I guess, with each of these particular factors. So this is going to be an overview to looking at natural approaches to pain relief. In this presentation, I'll be talking mostly in generalities about lifestyle measures that we can take to try to reduce pain. However, there will be some specific recommendations that are made as well. And so I highly encourage you to consult your licensed chiropractor or other healthcare professional to get the best recommendations individualized for you. So what I'd like to accomplish in this video is to have you learn about some evidence-based strategies to reduce pain and inflammation. This can be done through lifestyle primarily, nutrition, possibly supplementation, exercise, chiropractic care, and various other lifestyle measures. Remember, this is not going to be a thorough presentation. I'm going to talk about certain factors that I've seen to be effective, but certainly there are many others out there. Many people come into our office and they ask a question like, I don't know why I hurt. I didn't really have any injuries that I can recall. I haven't been sick, and that sort of thing. Well, I'd like you to think about pain as a multifactorial type of issue. In other words, there are multiple factors that can contribute to pain. Many of them you probably don't think about on a typical basis. But when I point them out, I'm sure you'll realize that you have some of these. So looking at the top picture on the left, we can see a young girl with poor posture. Poor posture is one particular factor that might lead to, for example, chronic musculoskeletal pains, neck pain, headache, and that sort of thing. Medications can be an issue. Medications come with side effects. Some of those side effects might include pain. Previous injuries are interesting in that we know, for example, with musculoskeletal injuries, the major risk factor for having musculoskeletal pain is that you've already had that type of musculoskeletal pain. So, for instance, if you've had neck pain before, there's a higher risk that you would have neck pain again compared to somebody who's not had neck pain before. Stress is a huge problem, particularly the kind of stress you might call distress. So stress can be good, it can be bad. For example, exercise is a good kind of stress to the body, but there can be certainly stresses that overload us and overwhelm us, and those kinds of stresses tend to promote inflammation and pain, so we need to be able to deal with those. In terms of our foods, as I mentioned earlier, there are some foods that are going to promote pain and inflammation, other foods that are going to reduce pain and inflammation. So we want to know which foods are going to do what. Previous illnesses are a significant issue as well. They can predispose one to having issues in terms of pain. They might predispose one to setting up some kind of pattern, metabolic pattern or something of that sort that could lead to more long-term problems. Smoking as a potent source of almost anything negative to the body, whether it be inflammation, pain, whether it be cancer or something else. Looking down at the bottom right-hand side, we can see various postures that people adopt and various movement patterns. Some people just move differently. Well, I guess I would say that everybody moves a little bit differently than everybody else. So there are individualized kind of patterns. If you think about the way you do things throughout your daily activities, for example, you might, when you climb stairs, you might always begin to climb the stairs with your right side. Some other person may climb the stairs with their left side, and this may set up a particular kind of pattern. In other words, habits tend to produce and drive us down a particular pathway that it could be good. In some cases, if you consider it to be a quote-unquote bad habit, then those kinds of patterns are not going to be so great for us. So we need to be aware of these kind of patterns. An interesting finding in the last few years is that we know, for example, that people with back pain, once the episode clears, the back pain can lead to a certain type of movement pattern that doesn't tend to go away very fast. It may be there 6 months after the injury. It may still be there a year after the injury. Getting back to injuries, since I'm speaking about that, the injuries that we see, let's say take an ankle sprain, for instance, we know that once someone has an ankle sprain, the pain may go away after a few weeks, and the bruising tends to go away around that time too. And so we might think, oh, I don't have pain anymore and my ankle seems to be moving okay. But the patterns of movement and the ligaments themselves tend not to be as strong as they were before. And for instance, one thing we do know about ankle sprains and the damage to the ligaments is that ligaments, and this goes for other parts of the body too, not just the ankle, but ligaments, for example, will probably only heal up to about 70% of what they were prior to the injury. So we're left with some kinds of deficits. And so these aren't the type of things that people normally consider when they consider their pains. They think that injury from 5-10 years ago has nothing to do with their current problems, but I tend to find otherwise. So bottom line on this slide, lifestyle is related to pain. There's a lot of factors to consider, but I personally consider this a good thing, because if lifestyle is related to pain, lifestyle is something that we have control over for the most part, or we can do something about it, at least. If not of our own volition, we can get help from counselors or chiropractors or medical doctors or whomever to try to help us reduce the pain. Hopefully without drugs and without surgery. That's what this whole presentation is about. Well, what do we know about lifestyle? Well, lifestyle is hugely important. It's what I consider to be the day in, day out kind of activities that we all do. And these kinds of day in, day out activities tend to be the root causes of disease, and neglecting to prioritize lifestyle measures for prevention, the medical community is placing people at harm. And that's a quote from this journal, from the Permanente Journal in 2018, talking about lifestyle medicine. And these authors go on to say that many deaths and many causes of pain, suffering, and disability could be circumvented if the medical community could effectively implement and share the power of healthy lifestyle choices. Why should we care about natural ways to deal with pain? Well, I think one of the important issues these days is looking at this opioid crisis. And we realize that the opioid crisis has largely been because of pain. People are in chronic pain. They're looking for solutions. And doctors have considered opioids to be effective at pain relief, in the past at least. And so that kind of idea is changing with the knowledge of addictions to opioids, as well as the incredible number of deaths that are associated with opioid addiction. So with that in mind, the Centers for Disease Control and Prevention have put out a guideline recently that have called for non-pharmacologic therapy and non-opioid pharmacological therapy in particular for chronic pain. And so opioids are not the first line of therapy, but rather non-drug methods are thought to be the best solution, at least at first, to try to deal with this issue, to try to prevent these opioid deaths and the addictions that are common from these types of drugs. In getting to some of the what I would consider the root causes of pain tends to involve a concept called inflammation. So inflammation is the body's attempt to try to heal itself. And inflammation really comes in two forms, as we'll get to coming up, acute and chronic. But inflammation, bottom line, is an immune response of the tissues due to some sort of injury or damage. And normally it's a really good thing. I mean, we need inflammation. We break a bone, it helps us to heal. We cut our skin, it helps that to heal. We sprain an ankle, it helps us to heal. So when we have an injury or some sort of damage, we generate some sort of chemical reaction. Those are called inflammatory mediators. And so, for example, if we have a twisted ankle, that process, mechanical process in this case, would release inflammatory mediators that promote inflammation and pain. Signs of inflammation would include typically redness, heat, pain, swelling, and some sort of loss of function. I think we've all experienced this. For example, I'll pick on the ankle sprain again, where the ankle swells, it's red, it's hot. You don't want to move it, so that would be loss of function. And it takes some time for it to heal. So that's an example of acute inflammation. So acute pain and acute inflammation tend to be relatively short-lived, and they tend to respond to treatment oftentimes. But it's a warning sign. It's something that the body is saying, hey, I've been injured, something is going on, take care of me, hopefully, and try to help the body heal itself. Chronic pain, on the other hand, is not a normal process. This is an abnormal process, always. So long-term pain tends to come on with chronic inflammation. Chronic pain usually is beyond 6 weeks of pain. The definitions vary between chronic pain. So sometimes it's 6 weeks. Some people consider that subacute. Most times it's probably 12 weeks or beyond would be considered chronic pain. Anyhow, no matter how you look at it, chronic pain is long-term pain. People usually have this for years and years. And the fact of the matter is that chronic pain tends to be resistant to common treatments, medications, surgeries, things like that. Why this is so important is that over 100 million people in the United States have chronic pain. So we're not doing well with trying to help people in chronic pain. We talked about inflammation. So inflammation tends to be a precursor, it seems, for various diseases. And recently, it's been proposed that inflammation is kind of like a root cause for many of these diseases. So cancers, cardiovascular diseases, metabolic disease such as diabetes, osteoporosis, osteoarthritis, psoriasis, autoimmune type of disorders, neurologic disorders like Parkinson's and Alzheimer's. So there's a lot to be said for inflammation and the promotion and generation of pain. So what are some things that would tend to promote that low-grade systemic inflammation that you might not even feel? For example, many people don't feel inflammation that helps to clog up their arteries that might lead to a heart attack. They might have some chest pain, they might have some symptoms, and those, I think, are the lucky people, because that's the warning sign coming through. But many people don't have symptoms. So again, what kind of things can lead to this chronic low-grade inflammation? I think it comes down to lifestyle. So, for example, we talked about the bad habits, maybe slumping, which could lead to different ways in which your joints are moving or experiencing stresses, and this could lead to stiffness and pain. Physical limitations from that. It could lead to joint inflammation that we might ultimately call osteoarthritis. The effects of our diet contribute here. Psychosocial issues contribute. Being overweight contributes. Certainly physical inactivity is a huge contributor to this as well. How do we measure pain? When you go to the doctor's office, I'm guessing you've probably all seen something like this before. We might measure pain on a 0 to 10 scale, with 10 being the worst imaginable pain and 0 being nothing, and oftentimes you just rate it by circling a number. What's interesting is that the treatments that are designed to try to reduce pain are not that great at reducing chronic pain. So, for instance, non-steroidal anti-inflammatory drugs, muscle relaxers, antidepressants for acute and chronic low back pain do provide some means of pain relief, but the results are not that impressive, somewhere between 10 to 20% improvement of pain. So on average, if you came in, let's say, with 10 out of 10 pain, 10% reduction would be going from 10 to 9. 20% would be going from a 10 to 8. That's still a lot of pain. So there are many things that we probably want to explore to try to cut our pain down further. I talked about opioids a little bit previously. One of the things that's interesting about opioids is that it tends to not allow people to eat as well as they would otherwise. So nutrition has moved from being just a preventive modality to being disease management tool. This is a quote from Pollack et al. And so anyways, it's interesting that various disorders tend to lead us to not want to eat great, and that ultimately contributes to our pain and inflammation as well. Well, opioids, to continue on this line of logic with what happens with opioids and how it may help with pain or not help so much with pain. There was an interesting study that came out in July of 2017. Well, this is a write-up about that study in the back letter. And it was about a landmark trial that, as they say, punctures the myth that opioids provide powerful relief of chronic pain. So what we found out from that particular study is that opioids are not as great as we once thought them to be. They provide somewhere in that 10% reduction range for chronic pain. So it comes with serious consequences, perhaps, for many people, especially if they become addicted to the medicine. And it only provides very modest relief of pain, if any relief. So that's when we look at all of these concepts and we think to ourselves, okay, well, what can lifestyle do? Is there any chance that lifestyle can help? And there certainly is. So we'll explore some of the science here. And again, if you would like more in-depth information about any of these topics, you can just send me an email, and I'd be happy to try to go more in depth on some of these issues. So lifestyle changes, especially dietary habits, are the basis for chronic systemic low-grade inflammation and many of the Western diseases that we have in our society today. So if that's true, then we can make these lifestyle changes in a positive direction to try to reduce pain and inflammation. So I'd like to talk about several specific strategies to reduce pain, including nutrition, exercise, sleep, not smoking, stress management, supplementation. We'll talk about chiropractic care as well. The standard American diet, as it's sometimes called, is otherwise known as the Western diet. You could call it the SAD diet, standard American diet, because what this SAD diet is essentially that many of us eat in the Western Hemisphere is a lack of fresh fruit and vegetables with strong reliance on fast food, high sugary beverages, high fat dairy, refined carbohydrates, and red meat. And this kind of diet has been shown not to be great for your health. It tends to promote inflammation, and it tends to ultimately promote pain. So we'd like people to shift away from that kind of diet to a more healthful diet. Nutrition and pain is a big topic these days. This article by Dr. Tick, she mentions that, again, getting to the SAD diet that many of us have, many of us eat highly processed foods that are high in calories and nutrient deficient, and these lead to caloric excess. In other words, we might gain weight, and it leads to micronutrient deficiency, things like getting enough vitamin B12 from your foods or enough magnesium. And these types of things might predispose one to having chronic pain. There are some useful tests for inflammation. Remember that chronic, systemic, low-grade inflammation that we might get from having a poor lifestyle. And these tests can be run mostly through standard labs. You could ask your physician or healthcare practitioner to run some of these tests. The one I'd probably recommend the most is C-reactive protein. It's relatively inexpensive. You can certainly look for other markers of inflammation, and they should come with a range. And if it's within the range, then I would suggest that your inflammation is not out of control. But if it's certainly out of the range, then that's something that might give you an indication that you might want to start changing lifestyle around. Now, that's the C-reactive protein or any of these inflammatory markers are not the be-all, end-all. You also have to consider your symptoms and if you have any other underlying diseases. But it is a marker, one marker, that can be useful in determining what you may want to do, how you might proceed with some of these lifestyle changes. These next few slides might give you some idea of how nutrition can promote inflammation and ultimately pain. If we look at the left-hand side here where it says omega-3 family and the right-hand side where it says omega-6 family, certain foods predispose us to inflammation. The foods that tend to promote inflammation are ones that are highly processed, high carbohydrate foods. And those types of foods, for example, might be high in omega-6 fatty acids. So things like animal fat, dairy, shellfish are common examples that might promote inflammation. So they lead to chemicals that you might call eicosanoids that tend to promote inflammation. Fortunately, there are ways to get around driving that pathway. So if you're eating a lot of those foods, grains and vegetable oils and processed foods that are high in carbohydrate, for example, then you could make a shift to a different style of eating. One that might, for example, be plentiful in plants. So, vegetables and fruits. And these types of foods tend to be anti-inflammatory in nature, so they promote less inflammatory pathways. And so I'd like you to think, when you're eating a meal, for example, Is this food going to be health promoting or, let's say, anti-inflammatory? Or is it going to be detrimental to my health? Is it going to be increasing inflammation? We'll get into what kinds of foods are best in terms of reducing inflammation, reducing, for example, heart disease and things of that nature, and reducing pain coming up. On this slide, what it shows at the top is cell membrane. And so when the food enters the cell, when the various chemicals that we talked about, for example, omega-3s and omega-6s enter, they interact with the contents inside the cell and ultimately can change the way the DNA expresses itself. And so, for instance, we can see at the top here an enzyme phospholipase A2, and that helps to convert our foods into arachidonic acid. Arachidonic acid then can get converted into various types of eicosanoids. And so these are thromboxanes, prostaglandins, leukotrienes, and the like. And these types of chemicals can either increase inflammation or decrease inflammation. So on this slide, we can see various prostaglandins and leukotrienes and these chemicals that are tending to promote inflammation. And so this might be, when you eat junk foods, foods that are highly refined, in other words, not plants, not vegetables, not fruits, we tend to promote inflammation. That's all this slide is trying to show. And then ultimately that inflammation can lead to things like atherosclerosis, heart disease, joint pain, brain fog, and that sort of thing. On the other hand, if we eat foods that are anti-inflammatory in nature, we tend to block the enzymes that lead to these inflammatory eicosanoids or inflammatory chemicals. We'll just call them that. So again, eating a particular way can predispose you to having pain because you're emphasizing certain painful pathways. Eating good, if you will, on the other hand, eating healthful foods that are anti-inflammatory tend to not drive you down those pathways, but drive you down healthful pathways that are anti-inflammatory. On this slide, we can see that there are some medicines, for example, non-steroidal anti-inflammatory drugs that will block certain enzymes like the COX enzymes and the LOX enzymes, and these tend to reduce the level of pain that one has because they're blocking the production of these inflammatory eicosanoids. The only issue is, or I guess it's not too much of an issue, because it does tend to work, but I guess the problem as I see it is, why not just change the diet? Just change what you're eating, and so that you're not driving these inflammatory pathways, but rather driving more anti-inflammatory pathways. And those pathways can be healthful. On the slide, we can also see other products that might help to modulate the pain. They tend not to be as powerful for sure as drugs like corticosteroids or non-steroidal anti-inflammatory drugs. But things like bromelain, ginger, EPA that comes from fish oil, quercetin, garlic, these sorts of things can be helpful in reducing pain. This past year, there was an article that came out talking about the anti-inflammatory diet in clinical practice, and it was basically a review of the scientific literature. And what they found was that specific foods are now known to exert strong effects on inflammatory pathways within the body. So strong effects, they say. Carefully selecting foods that are anti-inflammatory in nature while avoiding foods that are pro-inflammatory, or in other words, driving your inflammation, is central to an anti-inflammatory diet plan. And I would add that clinically, I've seen that if you select anti-inflammatory foods, your pain tends to go down as well. And so it makes sense because inflammation oftentimes is associated with pain. Well, what kind of way should people eat? There are many different diets, of course, out there. One diet that's been successful and probably the most studied diet in terms of reducing inflammation, in particular with cardiovascular disease, is the Mediterranean diet. So this is an example of Mediterranean diet. And so here we can see that at the base of the pyramid, what we should be eating virtually all the time are vegetables and fruits. In other words, plants. So plants form the base of the pyramid. That's what we should be eating. And then healthful fats. Fish, for example, which are high in omega-3s, those good fats that help to reduce pain. And more sparingly, we should be consuming, for example, things like supplements. Red wine, for instance, is allowed on the Mediterranean diet, but it's sparing. And then healthy sweets are right at the top. So we don't want to be having those things day in and day out, but they can be more sparing. They can be once in a while type of things. In addition to the Mediterranean diet, some authors have talked about a paleo-Mediterranean diet, and this might be another solution. Again, there are many types of diets that could be very successful for one in reducing inflammation, but I think what they mostly share in common is a commonality of consumption of vegetables and fruits. So with this paleo-Mediterranean diet, the emphasis is on fruits, vegetables, nuts, seeds, and berries, and high-quality protein sources such as fish, again, high in omega-3 fatty acids. Things like sardines and anchovies are particularly high in omega-3s. So some people don't like eating that, and so they might supplement, for example, with omega-3 fatty acids. Poultry, eggs, grass-fed meats are emphasized in this type of diet. I must talk about food sensitivities here, just to mention it, that some people have food sensitivities that might actually drive their immune system in the other way to promote inflammation. So I've got a slide coming up about food sensitivities, so I'll expand on that a little bit more later. So whey protein, soy protein are possibilities also for anti-cancer type of scenarios, cardiovascular benefits, and there's certainly some immune benefits to whey protein as well. Eating a lot of starchy vegetables is discouraged on many types of diets, especially elimination types of diets where one is trying to figure out what foods might be the culprits in generating pain or generating inflammation and various symptoms and disorders. Grains are discouraged because they tend to have immune constituents to them, particular gluten. Many people have gluten sensitivities that they don't know about. Despite eating gluten and not feeling well, it's oftentimes a source of problems that we see in the office. What are some supplements that seem to work? This comes from Medical Clinics of North America in 2017. And so here are some evidence-based supplementations for chronic pain. And so we see things like alpha-lipoic acid. This has been studied in, for example, back and leg pain in the musculoskeletal realm, but generally just in pain as well. Curcumin might be the most researched spice when it comes to pain. Some people have called it nature's gold. It's the type of spice that, for example, you might find in common Indian foods, curry, for example. Magnesium is something that I frequently recommend supplementing with, simply because many people are deficient in magnesium. So we tend to find magnesium in nuts and leafy greens and other plants, and so probably because people don't consume enough of that, we tend to be deficient in these. So it's relatively easy to supplement with many of these products if people are not getting it through their diet. There are certain anti-inflammatory botanicals as well. Turmeric, again, was mentioned on the other list in the form of curcumin. Then ginger, boswellia, bromelain, which comes from pineapple, devil's claw, quercetin, which is a potent antioxidant, cayenne from cayenne pepper. So there are various uses of these types of products. Again, I'll probably get into this in a little bit more detail in a subsequent video. I wanted to mention food sensitivity tests. Here is an example report. So food sensitivities can usually be done by blood work. And the idea here is to find foods that you may be sensitive to that may be driving your immune system to produce inflammation and ultimately pain. So in this food sensitivity test, again, there are many labs that do these kinds of tests. This is just one lab called LCAT. But on this report, you can see that this person who was tested had severe sensitivities to apricot, blueberry, pork, and raspberry. Now, these may be foods actually that people might consume very frequently. So it's interesting to get these kinds of tests done to try to identify what might be painful triggers, because if you don't know that you're sensitive to foods, you may just be, in essence, driving your inflammatory pathways and not even realizing it. So it's kind of a nice report. It gives you severe, moderate, mild intolerance, and then it gives you the green list of things that you tend to do pretty well with. Let's talk about physical inactivity for a little bit. Physical inactivity is another significant component of the lifestyle that tends to drive inflammation and perhaps ultimately pain. So exercise has been described by some in the scientific literature as a polypill. A polypill is something that has multiple ingredients in it to try to treat disease. The only thing is with exercise is that there's obvious benefits to exercise. It can treat almost every disease. It's great at prevention, and it's low cost, and it practically has, minimal side effects. Certainly you could be in danger of spraining an ankle or something akin to that, but short of having an injury, which you could possibly do even when you're not exercising, the risk to benefit ratio is pretty low, so a very low risk with physical activity. It's something, if you're concerned about, I would certainly recommend talking with your healthcare provider. That's always a good suggestion with any of these things that we're talking about. But generally speaking, most can exercise or at least do walking or something that would contribute to their overall health and well-being. What's interesting, I find, is that as authors mention, as opposed to exercise, no drug intervention has been efficient to maintain muscle fitness, a key factor to ensuring independent living throughout all stages of life. So really, nothing can duplicate the kinds of effects that we see with exercise. Regular physical activity, therefore, is thought to be helpful for reducing pain and inflammation, both aerobic type of exercise. This would include high intensity exercise, even lower types of aerobic exercise. Both can be helpful. Resistance exercise, in other words, strength training, can be helpful as well at improving pain and inflammation. Intensive lifestyle interventions involving both exercise and diet seem to be the most effective. So that's another key message I'd like to share, is that, there may be some things that you may be able to more quickly adopt in terms of your behaviors for changing your lifestyle, and that would be great. But the more things that you can modify where there might be issues, probably the better the response you're going to get, the less inflammation and ultimately the less pain. So do your best and get some kind of healthcare practitioner or someone that's knowledgeable to help you to work on as many of these factors as possible. What are the anti-inflammatory effects of exercise? Well, this has been investigated across multiple disorders. For example, in diabetes and cardiovascular disease, which are some of the leading causes of death, cardiovascular disease especially. So physical activity represents a natural, strong anti-inflammatory strategy with minor side effects and should be integrated in the management of patients with cardiometabolic diseases. This comes from the European Journal of Clinical Investigation this past year in 2017. And there's a lot to it, looking at various chemicals. So if you look in that results section here in the abstract that talks about all the various chemicals that they looked at to measure the anti-inflammatory effects. But basically, if we couple the strong anti-inflammatory type of strategy of eating well and the strong anti-inflammatory strategy of exercise, we're probably going to go a long way to making progress on reducing inflammation and pain. What are physical activity guidelines? Well, adults should be getting about 2.5 hours a week of moderate intensity activity, so about 150 minutes per week. What should children get? Children should be getting about 90 minutes a day of physical activity. So if we look to our youngest children and our oldest children alike, we see that children oftentimes don't meet those guidelines that are being recommended. And so that may predispose one to developing these kinds of problems. So another thing is that we see children with poor postures. The poor postures may themselves promote pain. Then because they're playing on watching the iPad or something like that, they're looking at their tablets or phones or whatnot, they're not engaging in the physical activity, and then that's another lifestyle habit or behavior that tends to promote pain and inflammation. Oftentimes, these things come together, and then if they have a poor diet, that's really going to start to contribute to issues. Exercise has been used to treat, or at least prescribed as a therapy, for many different chronic diseases. These chronic diseases, as we looked at before, tend to have a common root cause, which would be inflammation. At least that's the leading thought of today's scientists. And so exercise is being described lately as medicine. Food as medicine as well. You may have heard these terms. But there's a big push within the American College of Sports Medicine to describe exercise as medicine because it can be used as a therapy for chronic diseases, but it can also be used as a prevention tool to prevent disease. And it's one of the most powerful ways, in fact, to prevent disease. Patients oftentimes ask me, should exercise be painful in dealing with my musculoskeletal pains? So, for example, somebody might come in with low back pain and ask me about my recommendations for exercise. And I certainly like to provide exercise to every single patient, whatever they can do, because I know it's that useful for them and can help reduce pain and improve their healing response and ultimately their quality of life and wellness. So I like to incorporate it with every single patient. Sometimes, however, especially when people are in pain, exercise can be painful. Pain during therapeutic exercise for chronic pain need not be a barrier to successful outcomes, however. So as long as it's mild pain that you engage when you're doing activities and it's not excruciating pain, there seems to be benefit from engaging in physical activity and exercise, even when one has chronic musculoskeletal pain. So this comes out of the British Journal of Sports Medicine 2017. What about sleep? That's another lifestyle factor that can be a problem when it comes to pain. It seems that chronic pain may lead to sleep disturbance. Sleep disturbance may lead to chronic pain. So we don't really know what the relationship is exactly, but we do know that sleep and pain are bidirectional. They can interfere with one another. And when one doesn't have a good night's sleep, of course, I'm sure we've all had those nights before. We just don't feel well. We may feel a little bit more depressed. We certainly don't feel like exercising. We probably feel like eating sweets and treats and all sorts of inflammatory foods. So those types of scenarios are not good. We definitely need our sleep, restorative sleep, and there are many ways to do that. And I'll include some links to various practical ways to reduce your pain and inflammation with better sleep and diet and things of that nature underneath this video on the Essence of Wellness Chiropractic Center website. Suggestions for sleep. So again, I'll include these kinds of suggestions for better sleep. Avoid alcohol, avoid caffeine beverages, especially within a few hours of bedtime. Some medications may have stimulating effects. Make sure to get some exercise. Avoid anxiety-provoking activities before bedtime. I would suggest also things like turning off your cell phone. Don't look at your cell phone. Don't watch TV at least within an hour or two of going to bed. The blue light that people have, for example, that is emitted from cell phones can be a deterrent to getting good night's sleep. What about smoking? Smoking, a lot of people still smoke out there, and smoking is related to inflammation and pain, chronic pain in particular. So it can lead to depression, or depression may be associated with smoking. It can lead to osteoporosis and spine issues. Smoking is a known risk factor for back pain. It can also interact with opioids, those medicines that are prescribed oftentimes to try to reduce chronic pain. So whether we know it or not, many of these factors are interactive. So if you have several inflammatory producing types of behaviors, they tend to interact with one another. Conversely, when you do anti-inflammatory type of behaviors like eating well and exercising, those might be additive in a positive direction. Stress is a huge player when it comes to inflammation and pain. So oftentimes we talk about the differences between eustress, which is a good kind of stress. This might be the kind of stress that you derive from exercise. So that could be a good kind of stress, and we need stress on the heart to make it adapt and to make it grow and become stronger, so that we don't have as many heart beats in a minute, for example, so that we can pump more blood out with every given beat of the heart and that sort of thing. But stress can also be bad. And when we talk about bad stress, oftentimes we would call that distress, so distress. And the type of stress that we're talking about here is where your resilience is being overwhelmed. You're not capable of dealing with those kinds of stressors. And those things might be derived from life stress, just regular life stress in some cases, work stress. They could be from family, going through a divorce and these sorts of things. And so in those situations, you may want to consult a professional to try to deal with these kinds of issues. I oftentimes would refer to a clinical psychologist for counseling. And I want to make it clear that when I send people to a clinical psychologist, I certainly don't think they're crazy. In fact, I think they're just having normal problems of life. And so I want to help them deal with these normal problems. And people like psychologists, clinical psychologists in particular, in my mind, are the best people to send to. And there are some clinical psychologists that specialize in pain, and so those would be a great resource as well. So there are many things to think about when it comes to pain management in an integrative sense. We can see, just as the key words here for this article from 2017, integrative, non-pharmacologic, in other words, non-drug, yoga, acupuncture. So yoga and acupuncture we haven't really talked about at all thus far, but those certainly can be powerful tools. Mindfulness, meditation. Again, why we're interested in this is that chronic pain affects so many people. And so there's got to be an integrated way, non-drug, non-surgery way to try to reduce pain. And there certainly is, as we've been going through. This is just more evidence for how we get to that integrative way of dealing with pain. So here we can see a whole lot of different ways to try to get to some of the root causes of pain, or at least management of pain. And so we can see behavioral approaches. CBT stands for cognitive behavioral therapy. So that might be counseling in a practical sense. Physical things that one might be able to do to reduce pain, such as manual therapy, chiropractic care, chiropractic adjustments, for example, Tai Chi, yoga, group exercise. Then we have biological therapies, for example, some of the dietary sources or nutrients that might help us, such as magnesium. Biostimulation therapies, these might include electrical stimulation and other, what many people probably call physical therapies. Then we have our drug and interventional therapies that might include surgery on the other extreme, and nonsteroidal anti-inflammatory drugs, corticosteroids, and that sort of thing. And so certainly there's a place for medicines. There's certainly a place for surgeries. But what I'm trying to emphasize are the non-drug, non-surgical ways that people can try to deal with these things naturally, I guess in a more natural kind of way. So I mentioned cognitive behavioral therapy. Usually this is provided by a psychologist with a PhD or a PsyD. And cognitive behavioral therapy tries to get to the root issues, if you will, at why we are engaging in certain types of behaviors. So it gets to, what kind of thoughts might lead to these behaviors, and then being able to change those sort of things to get us on the right path, a more healthful path toward healing. Mindfulness meditation and yoga has been really talked about here in the last few years. There's some good research that's coming out about each of these that can be very beneficial to getting one to calm down, to, for example, take a deeper breath, use their abdomen for breathing. And oftentimes many of us breathe very shallowly, using our neck and upper chest muscles. And that's not nearly as efficient or practical or as effective as using the diaphragm by belly breathing. So these sorts of things, once we, can meditate and calm, relax, tends to promote a host of different mediators that are healthful. Here we can see a chiropractor doing an adjustment on the spine, and chiropractic care is one method to try to improve pain and inflammation, and it tends to be quite effective. In fact, recent guidelines, including those from the American College of Physicians, now are recommending chiropractic in the form of spinal manipulative therapy as a first-line treatment for acute and chronic back pain. So chiropractic care is a very useful method. There are many clinical guidelines that have chiropractic care included in them, not only for back pain, but for neck pain and other disorders as well. And so chiropractic care is a very useful strategy in this whole mix. And I want you to get the sense that there are many, many things that you can do to try to reduce pain from a natural standpoint, try to reduce inflammation as well. Chiropractic care is useful in that mixture. In fact, talking about pain, one other interesting thing that's come out recently was a study looking at the association between chiropractic services and the use of prescription opioids. And this was done in people with lower back pain. And what the results were was that the likelihood of filling a prescription opioid was 55% lower among chiropractic recipients as compared to non-recipients of chiropractic care. So there's some evidence that's coming out that chiropractic care, in addition to just reducing pain, whether it be acute pain or chronic pain, can also improve the opioid epidemic that's going on. It's if people follow the guidelines, which are to do things like go to a chiropractor first when having pain, low back pain in this case, we could probably not only save a whole lot of money, get people better quicker, perhaps reduce the amount of opioids, which is what this poster here is suggesting. So these are exciting times, and I want to just give you hope that there are many things that you can do to reduce your pain, reduce your inflammation, and not necessarily have to rely on drugs or surgery to get you better. Anyways, the major take-home message here is to try to engage the best kind of lifestyle you can. Hopefully, I've given you some practical pointers, some ideas to consider, food for thought, so to speak, about ways in which you can improve your lifestyle to reduce pain and inflammation. It's a big problem, but when you realize that there are many things that are in your control, you can try to tackle that problem safely and effectively. Thanks for listening.